If you wake up at night to urinate 3 or 4 times, if your shoes feel tighter for no obvious reason, or if you find yourself breathless doing activities that never bothered you before, stay with me for the next several minutes, because what I'm about to share may explain why your heart is struggling, and more importantly, how to recognize the danger signs before damage becomes irreversible. This is not about living in fear. This is about knowing what your body is trying to tell you while there's still time to act. Let me make you a clear promise right away. By the end of this message, you will understand the 10 most dangerous warning signs of early heart failure that doctors see every single day, but patients ignore until it's too late. Signs that appear weeks or even months before a crisis. And you'll know exactly when these symptoms demand immediate medical attention and what needs to change. Not eventually now. I'm Dr. Robert Harrison. I've spent decades treating patients with heart conditions, many of whom arrived in my office years after their heart first started sending distress signals. And one of the most heartbreaking things I see is how often early heart failure is dismissed as normal aging, weight gain, or just being out of shape. People are told it's nothing serious. They're told to wait and see. In many cases, that wait costs them dearly. So now I want to ask you one clear question, and this is your call to action. Have you experienced any unexplained shortness of breath, unusual fatigue, or swelling in your legs recently? And did you realize these could be your heart's first cry for help, not just signs of getting older? Write your answer in the comment section, because recognizing these patterns early is the difference between managing heart failure and being controlled by it. And once heart damage crosses a certain threshold, we cannot turn back the clock. Dorothy was 71 years old, active in her community, still driving, still caring for her grandchildren, but she noticed she was waking up 2 or 3 times every night to use the bathroom. Her ankles were swollen by evening. She felt breathless climbing the stairs to her bedroom. She mentioned it to her doctor, who told her it was probably her age and maybe her kidneys. But when we ran the right tests, we found something else. Her heart was failing to pump efficiently, and fluid was backing up into her lungs and legs. When we started treatment immediately, we stopped the progression. That decision to act instead of dismiss saved her independence and quite possibly her life. Here's the open loop I want you to hold on to. What were the specific signs Dorothy's body was showing that her previous doctor missed? And how many people reading this right now are experiencing the exact same warning signals without knowing what they mean? To answer that, you need to understand something fundamental about heart failure. Heart failure does not mean your heart has stopped. It means your heart is no longer pumping blood efficiently enough to meet your body's needs. Unlike a heart attack, which happens suddenly, heart failure develops gradually, often silently, and that's what makes it so dangerous. Here's where things start to get uncomfortable. The most dangerous aspect of early heart failure is not what you feel, it's what you don't feel. For months, sometimes years, your body compensates brilliantly. Your heart beats faster, your blood vessels constrict, your kidneys retain fluid to maintain blood pressure. You keep going, but underneath damage is accumulating. By the time symptoms become obvious, your heart may already be significantly weakened. Now here's the critical part most people never hear. Heart failure is not a single event, it's a process. And that process leaves clues. 10 specific clues that show up earlier than most people realize. These are not vague feelings. These are measurable changes your body is trying to show you. Sign number 10 is reduced ability to exercise or a sudden decline in your physical stamina. Activities that were easy 6 months ago now leave you breathless and weak. You used to walk a mile without trouble. Now you can barely make it around the block. This progressive decline is not inevitable aging. It's your heart losing its ability to meet physical demands. Sign number 9 is a rapid or irregular heartbeat that happens without exertion. Your heart is trying desperately to compensate for its weakened pumping ability by beating faster. You might feel palpitations, a racing sensation, or a fluttering in your chest. Sometimes this happens at rest or when you're trying to sleep. Your heart is working overtime and it's exhausted. Sign number 8 is confusion, memory problems, or difficulty concentrating. Your brain requires about 20% of your body's blood supply to function properly. When your heart can't pump enough blood, your brain suffers. You might forget appointments, lose track of conversations, feel mentally foggy. Family members often notice these changes before the patient does. This is not just aging. This is your brain being starved of oxygen. Sign number 7 is loss of appetite or nausea, especially accompanied by a feeling of fullness even when you've eaten very little. When your heart fails to pump blood efficiently, fluid backs up around your liver and digestive organs. Your stomach becomes bloated. You feel nauseous. You stop wanting to eat. Many patients lose weight from poor appetite while simultaneously retaining fluid weight. This combination is extremely concerning. Sign number 6 is extreme fatigue and weakness that doesn't match your activity level. You feel exhausted after simple tasks like getting dressed, walking to the mailbox, or preparing a meal. This happens because your heart isn't delivering enough oxygen-rich blood to your muscles and organs. Your body is running on low power all the time. People often blame this on poor sleep or stress. But when fatigue becomes overwhelming and persistent, it's a warning. Sign number 5 is a persistent cough or wheezing, especially at night, that produces white or pink-tinged mucus. Many people are treated for bronchitis or asthma when the real problem is their heart. Fluid in the lungs irritates the airways and triggers coughing. If you have a chronic cough that doesn't respond to inhalers or cough medicine, your heart may be the cause. Dangerous sign number 4 is shortness of breath that gets worse when lying flat. You find yourself propping up on 2 or 3 pillows to sleep comfortably, or you wake up gasping for air in the middle of the night and have to sit up to breathe. This is called orthopa, and it happens because fluid backs up into your lungs when you lie down. Your lungs become congested just like your legs, but in your lungs, that congestion makes it hard to breathe. Dangerous sign number 3 is unexplained weight gain, sometimes 2 to 3 pounds in a single day or 5 lbs in a week. This is not fat, this is fluid. When your heart weakens, your body retains water and salt to try to maintain blood pressure. That fluid shows up on the scale long before you feel sick. Many people don't connect sudden weight gain with their heart. They think it's diet or hormones. It's not. It's a red flag. Sign number 2 is swelling in your ankles, feet, or legs that worsens as the day goes on. You press your finger into your ankle and the indentation stays. Your shoes feel tight by afternoon. Your socks leave deep marks in your skin. This is called peripheral edema, and it's one of the earliest visible signs that blood is backing up in your veins because your heart cannot pump it forward efficiently. Sign number 1, the most critical warning of all, is waking multiple times at night to urinate. Not once, 3, 4, sometimes 5 times. This is called nocturia, and it happens because when you lie down at night, fluid that is pulled in your legs during the day gets reabsorbed into your bloodstream. Your kidneys, sensing the extra fluid, work overtime to eliminate it. This is not normal aging. This is your body struggling to manage fluid because your heart isn't pumping it effectively during the day. One of the biggest myths in senior health is that these symptoms appear suddenly. They don't. They develop slowly, often over months or years, while the underlying damage keeps building. By the time most people seek help, they're in moderate to advanced heart failure. Let me ask you something important. Have you ever been told you have high blood pressure, diabetes, or coronary artery disease, but your symptoms were dismissed as unrelated? That's often where the danger begins. These conditions directly damage the heart over time, making heart failure more likely. The symptoms I just described are not random. They're connected. Now, I want to pause here because this is where many people say, but I don't feel that sick. And that's the problem. Heart failure is a master of deception. You can have significant heart damage and still function. Your body adapts remarkably well until it can't anymore. And then decline happens quickly. Here's another open loop. If these warning signs are so common, why do so many cases of early heart failure go undiagnosed? The answer is pattern recognition. Patients don't connect the dots because each symptom seems minor on its own. Doctors sometimes miss it because they're looking for dramatic symptoms, not subtle combinations. Let me walk you through how this happens, step by step. Your heart weakens gradually due to high blood pressure, blocked arteries, or valve problems. Initially, your body compensates. You don't notice much. Then fluid starts to accumulate first in your legs, then in your lungs. Your kidneys react by retaining more salt and water, which worsens the fluid buildup. Your heart tries to pump harder and faster, which exhausts it further. Oxygen delivery to your brain and muscles drops. Fatigue sets in, confusion follows. And because this process is gradual, you adapt to each new limitation without realizing how far you've declined. Here's a piece most people never hear. Heart failure has stages. Stage A means you're at risk but have no symptoms or heart damage yet. Stage B means you have structural heart damage but no symptoms. Stage C means you have symptoms and heart damage. Stage D means symptoms are severe despite treatment. Most people don't seek help until they're in stage C. But the best time to intervene is in stages A and B before symptoms appear. Let me tell you about Thomas. He was 68 years old. He had high blood pressure for 20 years, but rarely took his medication. He noticed his legs swelling and blamed it on sitting too much. He felt short of breath climbing stairs and blamed it on being out of shape. He gained 10 lbs in 3 weeks and blamed it on holiday eating. When he finally came to see me, his ejection fraction, which measures how well the heart pumps, was only 30%. Normal is 55 to 70%. His heart was severely weakened. We started aggressive treatment, but we were managing damage that could have been prevented if he had recognized the warning signs months earlier. Approximately 6.7 million Americans currently live with heart failure, and that number is projected to reach 8.7 million by 2030. The lifetime risk of developing heart failure is now 1 in 4. That means 1 in every 4 people will experience this condition. Early detection matters because it changes outcomes dramatically. This brings us to the most important question, and this is where the second part begins. If these 10 signs are warnings of early heart failure, what do you do when you recognize them? Who do you see? What tests should be done? And what can be done to stop heart failure from progressing? Now let's talk about the part that gives you power. If your body is showing these 10 warning signs, what happens next? What tests confirm or rule out heart failure? And what realistic steps can you take to protect your heart and your future? This is where many people expect complicated medical jargon and expensive procedures. The truth is more straightforward than you think. And that's why it's so often overlooked. The first and most important step if you're experiencing any combination of these symptoms is to see a doctor who will take them seriously, not dismiss them, not tell you it's just aging. You need someone who will listen, examine you carefully, and order the right tests. Early heart failure is diagnosed through a combination of clinical evaluation and specific tests. The most important initial test is something called BNP, or NT-proBNP. This is a blood test that measures a hormone your heart releases when it's under stress. Elevated levels strongly suggest heart failure. This test is simple, inexpensive, and incredibly informative. If your doctor hasn't ordered it and you're experiencing these symptoms, ask for it. The second critical test is an echocardiogram. This is an ultrasound of your heart that shows how well your heart is pumping. It measures your ejection fraction, which is the percentage of blood your heart pumps out with each beat. Normal is 55 to 70%. If yours is below 50%, your heart is struggling. If it's below 40%, you have significant heart failure. This test is painless, non-invasive, and essential. The third test is a chest X-ray. This shows whether fluid has built up in your lungs, which is a key sign of heart failure. It also shows whether your heart is enlarged, another important clue. Additional tests may include an ECG to check your heart's electrical activity, blood tests to check kidney function and electrolytes, and sometimes more advanced imaging like a cardiac MRI or stress test. But the BNP and echocardiogram are the foundation. Once heart failure is diagnosed, the focus shifts immediately to treatment. And here's something critical to understand. Heart failure cannot be cured in most cases, but it can be managed. Progression can be slowed, symptoms can be reduced, quality of life can be preserved, and in some cases, heart function can even improve with the right treatment. The cornerstone of treatment is medication. Several classes of drugs have been proven to extend life and improve symptoms in heart failure patients. ACE inhibitors, or ARBs, reduce strain on the heart. Beta blockers slow the heart rate and reduce workload. Diuretics eliminate excess fluid. Aldosterone antagonists protect the heart from further damage. SGLT2 inhibitors originally developed for diabetes have been shown to significantly improve outcomes in heart failure. These medications work together to give your heart a fighting chance, but medication alone is not enough. Lifestyle changes are equally critical, and this is where many patients struggle because they underestimate how much power they have. The single most important lifestyle change is sodium restriction. Most heart failure patients should consume no more than 1,500 to 2,000 milligrams of sodium per day. Sodium makes your body retain fluid. More fluid means more work for your already weakened heart. Reducing sodium allows diuretics to work more effectively and reduces swelling and shortness of breath. This means reading labels carefully, avoiding processed foods, and never adding salt to meals. The second critical change is fluid management. Many patients are told to limit fluid intake to about 1.5 to 2 L per day. This prevents fluid overload. It sounds simple, but it requires discipline. Tracking your daily fluid intake and your daily weight are two of the most powerful tools you have. The third change is regular moderate physical activity. This seems counterintuitive when you're already short of breath, but gentle exercise actually strengthens your heart over time. Walking is ideal. Start with 5 or 10 minutes and gradually increase. Exercise improves circulation, reduces fluid buildup, and helps maintain muscle mass. The key is consistency, not intensity. The fourth lifestyle change is monitoring your symptoms closely. Weigh yourself every morning at the same time after urinating before eating. If you gain more than 2 to 3 pounds in a day or 5 pounds in a week, call your doctor immediately. This is not normal weight gain. This is fluid accumulation, and it signals that your heart failure is worsening. Track your symptoms daily. Notice changes in shortness of breath, swelling, energy level, and appetite. Your observations are critical information for your medical team. Now here's an important caution. Heart failure is not a one-size-fits-all condition. The type and severity vary. Some people have heart failure with reduced ejection fraction, meaning the heart muscle is weak. Others have heart failure with preserved ejection fraction, meaning the heart muscle is stiff. Treatment approaches differ slightly. This is why working closely with a cardiologist who specializes in heart failure is essential. Barbara came to me at age 73. She had been diagnosed with early heart failure 6 months earlier. She was taking her medications faithfully, but she was also eating frozen dinners every night because they were easy. Those frozen dinners contained over 2,000 milligrams of sodium each. Despite her medications, she kept retaining fluid and feeling worse. When we identified the sodium problem and switched her to fresh home-cooked meals with minimal salt, her symptoms improved dramatically within 2 weeks. Her swelling decreased, her breathing improved. She had more energy. The medication worked better because she removed the obstacle. This brings us to a crucial point. Heart failure is not just about your heart. It's about your kidneys, your lungs, your brain, your entire circulatory system. Everything is connected. Diabetes worsens heart failure. Kidney disease worsens heart failure. Sleep apnea worsens heart failure. High blood pressure worsens heart failure. Managing heart failure means managing your overall health. At this point, I want to address something important. Many patients feel discouraged when they hear heart failure cannot be cured, but stopping progression is just as powerful as curing a disease. Less shortness of breath means more independence. Better sleep means better quality of life. Fewer hospitalizations mean more time with family. These outcomes matter enormously. One of the most harmful beliefs patients are given is that once heart failure is diagnosed, decline is inevitable. That belief itself is dangerous. Recent advances in medication, particularly SGLT2 inhibitors and newer therapies, have changed the trajectory of heart failure dramatically. Patients who are diagnosed early and treated aggressively can live for years, even decades, with good quality of life. Let me share one more story. A man named Robert came to me at age 66 with newly diagnosed heart failure and an ejection fraction of 35%. He was devastated. He thought his active life was over. We started him on guideline-directed medical therapy, which means using all the medications proven to help. We worked with him on sodium restriction and daily walking. We monitored him closely. Within 6 months, his ejection fraction improved to 45%. He felt dramatically better. He was able to resume activities he thought he had lost. That improvement happened because we caught it early and treated it aggressively. This brings us to timing. Early heart failure responds better than advanced heart failure. Swelling and shortness of breath are warning signs, not death sentences. They are signals telling you something needs attention now. Ignoring them allows damage to progress. Acting on them gives you the best chance of preserving heart function and quality of life. Now let me give you a simple, practical framework to take control if you're experiencing any of these symptoms. First, make an appointment with your doctor and specifically mention the symptoms you're experiencing. Don't minimize them. Don't say you're probably fine. Describe exactly what you've noticed and when it started. Request a BNP test and an echocardiogram if your doctor hasn't already ordered them. Second, start tracking your weight daily and your symptoms. Write them down. Note any swelling, shortness of breath, fatigue, or other changes. This information is invaluable for diagnosis and treatment. Third, review your current diet and identify sources of hidden sodium. Processed foods, canned soups, restaurant meals, and bread products are often loaded with salt. Start reading labels and choose fresh whole foods whenever possible. Fourth, if you smoke, stop. Smoking damages blood vessels and worsens heart failure. If you drink alcohol heavily, reduce or eliminate it. Alcohol can weaken the heart muscle directly. Fifth, if you're diagnosed with heart failure, take your medications exactly as prescribed. Do not skip doses because you feel better. These medications work cumulatively to protect your heart over time. Here's something I want to say very clearly. Anyone promising that supplements or alternative therapies will cure heart failure is not being honest. But anyone telling you nothing can be done is also wrong. There is real, meaningful help available. Early diagnosis and aggressive treatment save lives and preserve quality of life every single day. Heart failure is often the result of years of untreated high blood pressure, uncontrolled diabetes, or ignored symptoms. It makes sense that treatment takes time and commitment, but recognizing the warning signs early is always the first step. And that step is entirely within your control. These 10 dangerous signs, starting from number 10, declining stamina. Number 9, rapid heartbeat. Number 8, confusion. Number 7, loss of appetite. Number 6, extreme fatigue. Number 5, persistent cough. Number 4, shortness of breath when lying down. Number 3, unexplained weight gain. Number 2, swelling in the legs. And number 1, the most critical, waking to urinate frequently, are your body's way of asking for help. Listen to them, act on them, and give your heart the chance it deserves.